dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. Attention Deficit Hyperactivity Disorder (ADHD) is a behavioral disorder affects mainly children and teenagers. It's more common in boys than girls, and is usually noticed and diagnosed in their first years in school when parents and teachers notice that the kid has a problem in pay attention as well as abnormal hyperactivity. There is no obvious scientific evidence explains the definite cause of attention deficit hyperactivity disorder, but some medical studies showed that there are certain predisposing factors which increase the incidence of the disease. These factors include the following: 1. Hereditary. Kids with positive family history of attention deficit and hyperactivity disorder are at greater risk to develop the disease. 2. Heavy exposure to chemical substances, such as pesticides as well as vapors of mercury or lead, either during intrauterine life or during childhood. 3. Brain lesions, trauma, tumors, infection, inflammation, affecting the frontal lobe or brain centers that control attention. 4. Factors which interfere with baby's brain development during intrauterine life, such as maternal malnutrition, smoking, drug abuse, etc. On the same context, it's mistakenly believed that sugar and food allergy tend to be predisposing factors for attention deficit and hyperactivity disorders, but recent studies have found that conclusion is completely wrong. Kids with attention deficit hyperactivity disorder usually develop the following symptoms: being easily distracted, making mistakes constantly as they don't pay attention to what is said to them, poor academic achievement and neglecting of daily activities. Losing their personal objects is very common. It's noticed that the kid is always moving from one place to another. Kids with attention deficit hyperactivity disorders finds many difficulties in group playing as they can't wait their turn and always have troubles in playing quietly. The kid is talking excessively, so he can't make a conversation with others without interrupting them on the other side. Adults with attention deficit hyperactivity disorders are manifested with the following symptoms: psychological disorders, such as anxiety, depression, frustration, low self-esteem. Problems related to memory and concentration. Impulsiveness and poor anger management. Problems in their work and social relations. Increased the risk of drug abuse. There is no definite test can be used to diagnose attention deficit hyperactivity disorder. Diagnosis depends mainly on assessment of the presenting symptoms as well as talking with parents about their kids' behavior, medical history and social history. Also, the doctor will evaluate kids' IQ and will apply physical examination for assessment of vision, hearing, motor skills and verbal skills. Electroencephalogram (EEG) may be required too. Management of attention deficit hyperactivity disorder includes the following: 1. Following healthy lifestyle. Eating healthy, well-balanced diet consists mainly of whole grains, lean protein, fresh fruits and vegetables. Getting enough hours of sleep. Limiting the time of computers and smartphones. 2. Medications that act mainly on the brain chemicals, such as dopamine. Also, antidepressants may be prescribed too. 3. Behavioral psychotherapy. It aims to help the kid to control his abnormal behavior and put clear rules that will be very helpful in his social life. On the same context, some kids who show marked poor academic achievement, special education is strongly recommended. 4. Psychotherapy. It aims to manage emotional problems, especially in adults. In the end, do not forget to support the channel to encourage us to publish more.